Most common question folks have as they look to getting a reversal is, what are the chances? Will we become the parents of a lovely, beautiful baby and hold that child in our arms? That's why we do the reversals here at the Reversal Clinic. That's the only reason we do those. And we, in this video, want to give you the scientific literature for expected outcomes and also our own experience here at the Reversal Clinic the past 14 years with the U.S.'s largest experience. We'll also give some thoughts on different topics that are often questions people raise about increasing their chances for pregnancy after reversal. The landmark study in the field is the Vasectomy Study Group trial, the VVSG. I have it on the table here. Belker and others published this in the Journal of Urology in 1991. It was a 5-center trial with 5 different expert microsurgeons performing the reversals over about a 10-year period. The study has been cited in the literature almost 600 times, far more than any other study in the surgical or urological literature on vasectomy reversal. They looked at vasovasostomy in about 1,500 patients and looked at many different aspects and criteria and measurements around those reversals. He just put together a wonderful study. The results of that study are still used by physicians today to give expected outcomes for vasectomy reversal, as stated in the recent 2014 article published in Journal of Urology entitled Outcomes After Vasostomy for Vasectomy Reversal, a meta-analysis and review of the literature. This meta-analysis, done by groups at Emory and Cornell, stated very succinctly that this is still a landmark study. It is the benchmark for the industry, and it's still being used today for describing patient expectations prior to reversal. The definitions of the outcomes is very important. And the VVSG defined patency as the percentage of positive tests for sperm of the total number of tests obtained. So that's a very important description of success after vasectomy, as defined by the Vasectomy Study Group trial. It's the percentage of positive tests out of the total tests received. Return of sperm for patients. The other measurement was pregnancy, the other outcome. This was determined over a 2-year follow-up period. It's a 2-year pregnancy rate in the VVSG. They excluded patients who had been divorced, used contraception, or in which there was a female fertility issue. It's important to note that success rates are being changed in recent years in reporting of statistics after reversal. Specifically, the success rate is being used in a combination of patency and pregnancy. But in order for patients to be well informed, the patency rate should be the mark for the actual success of the procedure. And the pregnancy rate is the desired outcome that we all hope and long for our patients. If pregnancy data is inserted into some kind of a combined hybrid success rate, then the actual return of sperm rates for a practice or a study are inflated. And so it's much more integrity to use a true strict patency rate. That's the rate the VVSG used, that's the rate that the Reversal Clinic has used over the past 14 years to measure outcomes. So that's a broad definition of the VVSG study and its inclusion criteria. I'd like to briefly explain the table here. The first column is the obstructive interval, that is the years from vasectomy. The second column are the patency and pregnancy results for the VVSG, and the third column is the patency and pregnancy rates for the Reversal Clinic, TRC. The statisticians that reported the VVSG findings were able to clump or group patients in terms of outcome according to years from vasectomy. It was being concluded by the VVSG and the recent meta-analysis that increasing years from vasectomy decreases outcomes, both patency and pregnancy. Now, the VVSG used 4 subgroups: less than 3 years, 3 to 8 years, 9 to 14, and greater than 15 years from vasectomy. So we'll walk through these findings for both the VVSG and the Reversal Clinic. I'd like to say that the total number of patients is greater in the Reversal Clinic's experience. The pregnancy data in the VVSG was a result of about 800 patients they were able to follow in the 2-year follow-up period in that landmark study. The patency data was obtained from 1,000 patients they had semen analysis test results. So again, about 800 in the pregnancy data and about 1,000 patients in their patency data, their sperm test results data. The Reversal Clinic is about 4 times the follow-up for pregnancy, about 3,300 patients, versus the VVSG. The patency follow-up in the Reversal Clinic is only about 2.5 times, or about 2,500 patients in the semen analysis test results we have. The discrepancy why there's less semen tests, I think, is in large part due to that our patients often will not do the test and just wait for pregnancy, and often will never have a semen analysis if a pregnancy comes fairly soon after the reversal in a matter of months. So we'll walk through these data. Less than 3-year category, the VVSG found 97% of patients had return to sperm with a 76% pregnancy rate. The Reversal Clinic's experience is 96% for patency or return of sperm and 82% for pregnancy. Again, that's for couples who have no female fertility issues. The next group for the VVSG was the 3 to 8 year category. In that category, 88% had a return of sperm and 53% achieved pregnancy. We saw in the Reversal Clinic's experience early on that the patients in this 3 to 8 year category were not homogeneous. In other words, the patients toward the end of this time period were had outcomes different. So we divided this group. We don't have a 3 to 8 year figure to show you here. We divided this group into the 3 to 6 year and the 7 to 8 year categories. In the 3 to 6 year category, 91% have had return of sperm in the Reversal Clinic's experience, and 74% have achieved pregnancy, again with no female fertility issues. In the 7 to 8 year category, 83% have had return of sperm and 60% pregnancy. So you can see that the outcomes taper off towards the end of this VVSG group, and we think it's very, very useful to patients to break these subgroups down. So we have 5 subgroups where the VVSG has 4 in their outcome data. The next category, the 9 to 14 year category, 79% of the VVSG had return of sperm, 44% pregnancy rate. The Reversal Clinic, 74% with patency and 46% pregnancy. The greater than 15 year category, 71% with patency or return of sperm in the VVSG trial, 30% achieved pregnancy, 70% have had return of sperm in the Reversal Clinic experience, and 45% of our patients in this category have had pregnancy. This 30% figure here, I think, is not really reflective of the actual odds that these patients have in the VVSG. This group is very small in the VVSG, probably about 40 patients. We have a much larger group, well over 100, that gives us a better picture of how these patients could expect in their outcomes. Now, there are, as I said, some issues that come up over and over again about helping rates or improving chances. And one of these is testing. The question comes up about anti-sperm antibody testing. And this study actually didn't look at that, but several other studies have, and there's no information that would indicate that anti-sperm antibody testing before surgery would help at all with outcomes in these patients. We believe strongly that the anti-sperm antibodies have a very, very minimal role in fertility after reversal. Vitamins, supplements often come up in terms of what can we do to improve our odds, and the fact is there's no scientific studies in the reversal populations for supplements or vitamins. Now there's some information in the general population that may show benefit, but there's no science showing a particular regimen or collection or vitamin or supplement will in fact improve chances of patency and pregnancy. Now if taken in the recommended amounts, it's very unlikely that those supplements would actually decrease outcomes. There's some other treatments that are proposed. You may have seen them on websites or discussed on forums, namely NSAIDs and also steroids. Unfortunately, there are no scientific studies showing benefit in those populations to improve outcomes. There are known deleterious side effects of both steroids and NSAIDs, so we at the Reversal Clinic do not recommend these treatments because, again, they haven't been proven. We take very seriously the admonition to first do no harm. So we can't tell you that those regimens would be of help at all, and they might be of harm if there were bad side effects. The last category we want to briefly touch on is things to avoid. Again, there's no scientific trials in the reversal population, but just from a common sense point of view, there are some definite things that are known to decrease sperm counts. These would include tobacco, daily alcohol consumption, illicit drugs, can all decrease sperm counts. Those things should be avoided if you want to be a daddy. Now, the main actor here in terms of a prescription medication would be testosterone. You want to get off testosterone if you want to be a daddy. If hormone replacement is needed for some purpose, then other agents can be used. You can talk to your primary care or your reproductive endocrinologist if that's necessary, but you want to get off the testosterone. Also, other possible causes of decreased sperm production with medications would include steroids, some heart medications, some high blood pressure medications, some antibiotics. So again, you want to check with your primary doctor to see if those are potential downsides to the medications you're on, so you improve the odds of pregnancy. So I think you can see from this data that's corroborated by other studies that folks who are looking to do a reversal can really expect a really good opportunity to grow their family after simple vasovasostomy. The approach the VVSG took, a simple tube-tube vas-vas reconnect, is the approach that the Reversal Clinic has taken. We believe that's the standard of care, as discussed on another video we put out. You may want to take a look at that, but we feel good that we're doing the best thing for our patients and giving them really prime opportunities for childbearing. It's unique in the Reversal Clinic that you can actually confirm our statistics. We put out a referral list. Hundreds of patients have agreed to speak with folks, and so if you go to the reversalclinic.com, you can fill in a contact form and just request a referral list. You'll give your year since vasectomy with the contact form, and we'll be able to get you the subgroup of patients that you need to speak to talk with folks how they did after the reversal. Well, this is Dr. David Wilson again with the reversalclinic.com. Thanks for watching today, and we'll see you on the next video.